And we are live. Colleen, I am recording from my computer, so hopefully.
All right. Hi, everyone. This is Colleen Knightledge with Voice of the People. I'm the Resident Services Coordinator, as Lori Alexander, as well as our healthcare provider from Heartland Health Centers, Dr. Sonia Ayola, and our Voice Resident Services intern, Lisa Chang. And so today we are doing a Q&A session related to questions that Voice residents have had regarding COVID-19, especially as the city starts reopening or continues to reopen. Why it's still important to have these conversations and what people should be doing to continue to protect themselves during this time. Because as we all know, COVID-19 doesn't just disappear. It's still a concern, and we still need to make sure we're taking precautions. So without further ado, I'm going to let Dr. Sonia introduce herself a little bit more and give us kind of a basic rundown of what phase 3 means and what we should still remember, like any details about COVID-19 that is relevant that we should all know. So thank you.
Thank you, Colleen. Thank you so much. It's a pleasure to be here with everyone this afternoon. My name is Sonia Oyola. I'm a family medicine physician working at Heartland Health Centers, and I am honored to be here. I will be repeating everything in Spanish as well, right after going through the question and the answer here for you and for certainly the residents. The first question is about the basic knowledge that we should all know about COVID-19. And I think it's important to start with what are the common symptoms of COVID-19, because it can be quite confusing for a lot of us to know what are symptoms that we should think of more related to COVID-19 or not. So first of all, the most common symptoms of COVID-19 are shortness of breath, cough. Shortness of breath and cough are the two very common symptoms of COVID-19. There are other symptoms that are less common, but if you have any two of these symptoms, then you really do have to consider that you might have COVID-19. One is body aches, chills, headache, sore throat, and a loss of taste or smell. Okay, so those are the second most common symptoms, but any one of those two, if you have them, you may have COVID-19. The more common symptoms are cough and shortness of breath. Okay. In general, when you're thinking about the common symptoms, also along with chills, you have fever as well. Okay, so cough, shortness of breath, fever, less common, like I said, a loss of taste of smell, headache, body aches, sore throat. Entonces, buenas tardes todo el mundo. Me llamo Sonia Oyola, soy una doctora de medicina familiar que trabaja en Heartland Health Centers y tengo el placer aquí de hablar con ustedes del COVID-19. Tengo el placer de hablar con ustedes aquí por Facebook y también hablar para los residentes que viven en La Voz. Primeramente, la pregunta es cuáles son las cosas básicas que necesitamos entender del COVID-19, y sería importante, por ejemplo, hablar de los síntomas clásicos y básicos y comunes, porque hay muchos síntomas y tenemos una confusión de cuáles son los síntomas que nos indica que tengamos COVID-19 o no. Los síntomas más comunes: tos, falta de la respiración. Síntomas menos común, pero si uno tiene dos de estos síntomas, debe de uno pensar que tiene COVID-19, son, por ejemplo, escalofríos, dolor de cuerpo, que le falte el olfato o que le falte el gusto, dolor de cabeza, dolor de garganta. ¿Ya? Esos son los síntomas menos común, pero si uno tiene dos de esos síntomas, debe de uno pensar que hay COVID-19. Y entonces, Voy a regresar con Colleen, que me va a preguntar otras cosas ahorita. So we'll go back to Colleen. Just went over the basic symptoms of COVID-19 so far. So if you have that.
Thank you, Dr. Sonia.
Of course.
So again, as I mentioned, as the city starts reopening, I know that there's a lot of confusion as to kind of what phase 3 means and what people should continue to do to protect themselves, and if these recommendations differ for other populations that might be more at risk.
Okay, great question. Thank you. So the question at hand about phase 3. Phase 3 is a phase that we're entering now in this pandemic, where we're noticing that fewer people are coming back positive, and there are fewer people needing to be hospitalized for COVID-19. So because we see a decline in those numbers, that's why the city is, and the state, and other states, surrounding states, have decided to, quote unquote, open. And what opening means is not a going back to how we were, but going back to some of our activities that we can engage in. For example, our public library that just opened. Some of our restaurants, the patio has now opened, the patio spaces. Some of the opportunities to go back to our facilities for eating and dining and for self-care, all of those facilities are trying to adjust to this pandemic by recommending certain practices. For example, we still have to wear a mask. We absolutely have to still practice social distancing. We are still encouraged very much and must wash our hands with soap and water as often as possible, especially if we've left the house, we've interacted out in the environment, and we've come back to our home. For example, when we go to our grocery store, or we go to the post office, okay, or if we've gone to that library. So you're coming back, you're wearing a mask to go out to that activity, or if you're dining outside in a patio at your favorite restaurant, you're going to that activity, but you're still wearing a mask and you're practicing social distancing. And what that means is having 6 feet or more between yourself and the next person. Okay, that continues to mean, with that definition, no hugging or handshaking or kissing on the cheek or coming into any kind of close contact with that other individual. So opening up just means going back to some of those activities, but still practicing all of what I've just listed. Phase 3 means an opening because we're seeing the numbers going down, but as soon as we stop engaging in those activities, as soon as we stop using our masks, we're no longer practicing social distancing or washing our hands and being mindful and careful, the rates will start to go up again. Okay. So, to repeat that in Spanish, para repetir todo eso en español, la pregunta de Colleen es la fase 3. ¿Qué significa la fase 3 ahorita en la ciudad? Han oído mucho que la ciudad está abriendo, otra vez, está abriendo la ciudad. Y simplemente lo que eso indica es que porque los números de las personas que salen positiva y porque las personas hospitalizadas son menos ahora, se están bajando estos números, la ciudad tiene la confianza de empezar a abrir lugares otra vez, por ejemplo, como restaurantes, pero no adentro, afuera, en el patio. O, por ejemplo, la biblioteca, ¿ya? O las otras tiendas que cortan pelo, por ejemplo, hacen diferentes tipos de servicios humanos a las personas. Pero en todas esas recomendaciones, las recomendaciones siguen igual en de que es tan importante usar una máscara, tan importante todavía tener distancia social, y lo que indica eso es tener una distancia de 6 pies o más entre usted y la próxima persona, y tan importante todavía seguir lavándose las manos. Cuando uno sale al restaurante o a la biblioteca o a la tienda a comprar sus comidas, regresar a la casa y lavarse las manos con jabón y con agua, y si no tiene jabón y agua para lavarse las manos, usar un producto para limpiarse las manos muy bien, ¿ya? Lo que le puedo decir es que el momento que dejamos de hacer esas prácticas, no usar la máscara, tener más contacto con las personas, no lavarse las manos, la tasa de este virus se va a subir otra vez, ¿ya? Y la distancia social, para tener mucha claridad, es evitar abrazar a la persona, besar a la persona, darle la mano a la persona. Es tan importante seguir con esas prácticas o se van a subir otra vez los números y entonces se va a tener que cerrar la ciudad otra vez. I just said a little bit more in Spanish, and to say in English, it's so important to continue our practices of social distancing and wearing our masks and washing our hands, because if those numbers start to go up again, remarkably, the city will have to close again. So that's what we're trying to prevent. We're trying to get back to our lives in some way, but adjusted, while at the same time avoiding a rapid rise in the virus cases, because if that happens, the city will have to shut down again, okay? And one thing I wanted to share is that I've noticed that, of course, the churches are opening. And the practice at a church is to shake hands, the peace, and hug and see your neighbors. And so remember, in that setting, all of the practices I just mentioned are as important, very much so. It's a time to resist the physical contact and really, from a distance, send your peace and your love to your fellow neighbor, okay? So en español le quería decir, las iglesias están abriendo ahorita, y entonces en esos lugares sí se practica mucho dar la mano de la paz, abrazarse. Eso es un lugar tan importante, por favor, de seguir estas prácticas. Este es el momento de darle la paz o el amor a su vecino, a su persona que está en la iglesia, a su compadre, su comadre, de lejos, de lejos.
Thank you. Lori, I don't know if you wanted to ask this one, but I know that when we were doing our pre-meeting and we were going over with our residents kind of the questions they were having, there were there's a lot of conversation about like what exactly, aside from masks, what we might need. Lori, do you remember what other items people were asking about if we needed to wear or have when we go out? You want to unmute yourself though? Sorry. Lori, you're muted.
Okay, I'm sorry.
No, it's
I'm sorry.
okay.
Can you hear me?
Okay.
Yes.
Yeah, I know that one of the things with the mask, I think I was a bit confused because they stated the social distancing for us to 6 feet, also wearing the mask. But what got me was that I saw people with their eyes covered, which is a good thing. And I also know that there are people that wear glasses. But for someone like me who don't wear glasses except reading, is it a good thing for me to continue to keep my eyes covered some kind of way for protection? Because if people cough, or sometimes they can talk to you from a distance, and still if it's cold outside, you know how you just see it's cold outside and you can see the mist of them breathing across the room outside. And I'm looking at how far that travel in the winter. But I'm thinking, if my eyes are not covered, am I protected?
Great question. Lori, if you are 6 feet or more from that person, even if they were to cough, the likelihood that the droplet that they just coughed out can travel that far into your eyes is very, very low. The eye protection is especially important for people that are coming really close, like, for example, a dentist. Excuse me. Or
The wonderful aspects of Zoom is when we have our pets interrupt. I'm surprised my cat hasn't come by yet.
Mine is on the floor right now.
my dog, she likes to bark at everything that passes by.
Okay.
So sorry about that. No, so people that are pretty close to another person's face, and they're coughing, or they're doing a procedure, like a dentist or an anesthesiologist or an emergency medicine doctor who's about to intubate someone, those people, or a nurse, a hospice nurse, like my sister's a hospice nurse. When she goes to visit patients and she's coming very close to their face, she absolutely has to wear a face shield to make sure that as they cough, the droplet that they've just coughed doesn't hit her eye. But if you're 6 feet or more from that person, even if they're coughing, you're not going to catch COVID in that way. The way that you would catch COVID is, for example, let's say they coughed and they use their hands to cover their cough. You know, we're supposed to cough, you know, into our elbow and not into our hands. But let's say they coughed into their hands and they went to touch something and they left, and then you walk by, and you're innocently walking around and you touch that, and there was still a fresh droplet on that surface, and then you picked up that droplet on your hand, and then you went to rub your eyes or rub your nose, or you started to eat and you hadn't washed your hands yet, so you've got that droplet on your fingers and on your food, and then you've eaten. That's how you can get it into your eyes. It's really from touching something and then rubbing your face, your eyes, your nose, your mouth. And I tell you, it's hard to not rub your eyes. People rub their eyes and their nose all the time. And so that's why it's so important to wash your hands so often, because if you're doing that, then all the times you've touched something, you're less likely to have those droplets on your fingertips. But great question. Thank you for that. That's excellent.
Thank you.
En español, lo que me acaba de preguntar Lori es, por ejemplo, ella ha visto a las personas usar ciertas protecciones para los ojos, y ella tenía la preocupación de que cómo se pueda captar el COVID-19 entre los ojos, y ella no está usando lentes, por ejemplo. Ella necesita usar lentes, necesita usar cualquier protección. Lo que le estaba explicando es que si ella está 6 pies o más dentro de esa persona, hasta si esa persona está tosiendo, la probabilidad que las gotitas que la persona ha tosido se pueda llegar esa distancia a los ojos de ella es muy, muy bajo. So, ella no va a captar COVID-19 de esa manera. La manera que pueda captar ella COVID-19 es, por ejemplo, vamos a decir que esa persona acaba de toser y no tosió ahí en el elbow, pero tosió en la mano, ¿verdad? Entonces, cuando está tosiendo ahí en la mano y va a tocar una cosa, vamos a decir, tocó la silla. Y pasó Lori, y ella no sabía que esa persona estuvo ahí, la tocó, y ella vino y tocó esa silla. Ahora ella tiene esas gotitas llenas de COVID en sus manos. Y vamos a decir, ahora tiene una comezón de los ojos y se va a sobar los ojos. Esa es la manera que ella va a contraer ese COVID, con esas gotitas, porque las gotitas están en las manos sucias. O si se toca la nariz, o si empieza a comer, por ejemplo, tiene el COVID ahí en la comida, no se ha lavado las manos, y ahí es como se va a infectar. Por eso es tan importante lavarse las manos con tanta frecuencia, porque cuando uno se lava las manos con mucha frecuencia, tiene menos probabilidad que las cosas que ha tocado va a tener el COVID en las manos y se va a contagiar. Thank you for that question. Gracias por esa pregunta, Lori.
Thank you.
Thank you. Okay, so I know that there are some people that are asking some questions on Facebook.
Sure. Yeah.
And we will get to those once we get through a few more of the ones that we have prepared. At which point Lisa will help us field those questions. I just wanted to let everybody watching know, because I realized I did not specify that at the beginning.
Nice.
So moving forward, because we have to continue taking all these safety precautions, and the virus, that with media attention and how serious the virus is, there's lots of people who are now having to go back to work or go back into the community, but there's still a lot of anxiety surrounding that. So I guess this question is more about how can people cope with their anxiety, and what are some ways that people can do to ease that concern, aside from maybe just wearing masks and practicing social distancing?
Of course, of course. I also wanted to fill in a little bit more in Spanish, my second answer.
Okay.
Lo que le había dicho también a Lori es que las personas que necesitan esa protección, por ejemplo, doctores de medicina de emergencia o anestesiólogos o dentistas, personas que se están acercando mucho, mucho a la cara del paciente, entonces esas personas absolutamente necesitan esa protección. So, eso fue lo que no les pude decir, y por eso quizás han visto esas imágenes de esas protecciones. Pero recuerda, esas personas están muy cercas a la persona o al paciente. So, going back to your question, Lori, Colleen, such a good question. Oh my goodness, around anxiety and how can we manage our anxieties during such a challenging time. And I would say, one of the first things that I go through with a patient is to get a sense of how long people have maybe had anxiety. Maybe they've had a degree of anxiety or stress for some time, and helping patients recognize how they've been able to manage their anxieties in the past. What are the skills that they've applied in the past that have been really helpful, very helpful to them? Sometimes in the middle of a crisis or a stress, we forget how well and we've been able to manage, and we forget that we have skills that we've learned throughout our lives to manage stress. So helping people reflect on that and recall those techniques and those ways and approaches of managing stress, I think, can be super, super helpful. Mm-hmm. The other patients, managing stress is about really looking carefully at what is feasible and what makes sense. There are a whole list of relaxation techniques and stress management techniques that I go through with patients because I'm an integrative medicine doctor. So as integrative medicine doctors, we combine conventional medicine with complementary medicine all the time. And the complementary medicine techniques that have been really helpful for anxiety are something called mind-body medicine techniques. Mm-hmm. That's examples of that would be breathing exercise. So taking a deep breath in to a count of 4 and out to a count of 4, and making sure that breathing is coming from the belly, from the abdomen, that is hugely relaxing. Sometimes another technique could be something called a body scan, where you're sitting in a chair or you're laying in your bed and you just take a mental note and an awareness check of your body from the top of your head all the way down to your feet, noticing what your body feels like and what it's going through. That can be super helpful, because once we know, we're more aware, and then we know what we can do about it. So that naturally is an important relaxation technique. The other is taking a walk outside, and that can feel scary to patients for sure, because they're like, but that's where people are at right now. They're outside, and I don't want to come anywhere near people. But remember that if you take all of the steps that Colleen just mentioned, wearing your mask, practicing social distancing, washing your hands, you're doing everything that you can to protect yourself. And if you're doing everything that you can to protect yourself, that naturally also helps with anxiety. Anxiety comes from a feeling of, what's going to happen, and I can't predict what's going to happen. But if you can prepare and protect yourself as best possible, you already naturally start to decrease your risk of catching this disease. So anxiety improves by taking those steps. So take those steps and then get outside and go for a walk. Walking outside and noticing the trees and the wind and the sun and connecting to nature naturally decreases our stress hormones. Within 15 minutes of being in a natural setting, our cortisol levels, which is a stress hormone, they start to go down. Our blood pressure actually starts to go down. Our pulse slows down, because these are settings that are evolutionarily, we're connected to these natural settings. These natural settings make us feel that we're at ease. And so anything from a breathing exercise to a body scan, to meditation, taking a walk, journaling. Journaling has been hugely helpful for my patients, especially patients that it's not easy for them to take a walk because, you know, they've got arthritis, their knees hurt, their backs hurt, they can't get out there. But if they can write down their fears and write down something that they're grateful for, that naturally decreases anxiety as well. So lots of different techniques, but I would say the one that you've done that you feel has been most helpful to you, gosh, is the one that you pull that one out of the box, because that's the one that's going to help you in this time as well. So la pregunta de Colleen es de la ansiedad. ¿Cómo uno puede manejar esa ansiedad durante este momento tan difícil, ¿verdad? Tan complicado? Y lo que le estaba explicando es que una de las cosas que hago primero con mis pacientes es preguntarles, por ejemplo, por cuánto tiempo quizás han tenido ansiedad. Han manejado ansiedad en el pasado y cómo lo han manejado, cómo han podido, qué han usado para controlar sus ansiedades. Porque esos techniques, esas maneras de manejar ansiedad, son maneras, si le han ayudado, son las maneras que apoyo al paciente a resumir. Haga eso otra vez. Si le ha ayudado, haga eso otra vez. En la medicina, yo soy medicina de medicina integrativa. So, como doctora de medicina integrativa, combino las medicinas convencionales con las medicinas complementarias. Y entre las medicinas complementarias que ayudan la ansiedad son las medicinas mente-cuerpo. Ejemplos de eso sería un ejercicio de la respiración, a donde uno respira dentro 4 y afuera 4, usando el abdomen para respirar, ¿ya? Otras maneras serían un scan del cuerpo, por ejemplo, sentada o acostada, mirar cómo se siente la cabeza, cómo se sienten los hombros, cómo se siente el cuello, cómo se sienten los brazos, de la cabeza hasta abajo. Y entonces cuando uno reconoce cómo uno se siente, cómo se siente el cuerpo, tenemos más sabiduría y sabemos qué podemos hacer para manejar y para ayudarnos nosotros mismos con nuestro cuerpo, ¿verdad? Hay pacientes que, por ejemplo, salen afuera a caminar. Ahora, en este momento quizás eso pueda dar un poquito de miedo porque uno dice, voy a salir afuera, ahí es a donde está la gente. Pero recuerde lo que dijo Colleen ahorita, que es tan importante, que uno debe de seguir usando la máscara, distancia social, lavarse las manos. Si uno está haciendo esas cosas, se está preveniendo, bajando el riesgo que va a captar esa enfermedad. Y eso es lo que puede hacer uno en este momento. Y haciendo esas cosas, naturalmente se va a bajar la ansiedad, ¿ya? Se han visto estudios que, por ejemplo, cuando la persona sale afuera, dentro de 15 minutos de estar afuera en la naturaleza, a donde uno mira el árbol, siente la brisa, siente el sol, dentro de 15 minutos se baja una hormona del estrés que se llama la cortisola. La cortisol es una hormona que provoca mucho estrés. Pero cuando uno está afuera, conectado a la naturaleza, se baja eso naturalmente. Se puede bajar la presión alta, se puede bajar el pulso. También se puede uno empezar a sentirse mucho más relajado, ¿verdad? Porque evolucionariamente el ser humano ha sido conectado a la naturaleza. So, cuando estamos en la naturaleza, eso nos relaja bastantísimo. Pero como le digo, la cosa más importante es en realidad reflejar de cuáles son las cosas que le han ayudado en el pasado y esas son las cosas que debe de uno sacar de la caja. Saque eso de la caja y haga eso otra vez, porque si le ha ayudado antes, le va a ayudar en este momento también.
Thank you.
Of course.
So Lori, I know that this one actually came from you, and it kind of it links very well with what Dr. Sonia just told us. It's aside from walking, what are like safe ways to get exercise during this time, especially for folks that are in that high risk category for contracting COVID? I know, for example, I this past weekend went on a bike ride, and on the bike path there were people with masks on, but then there are a lot of people without. What is the suggestion in like those scenarios? But then also, if you're afraid to go out, what are there other options that you can do maybe in your apartment or without having to go into more like crowded areas.
Great question. Great question. So yes, we've come to a time in our lives where it's limited us our ability to be physically active. In many ways, this is inspiring people to want to be physically active more than ever before. So it's a positive out of all of this moment. And being in the house, creativity is hugely helpful in this moment. So, for example, walking up and down your stairs. If you live in an apartment complex that has a couple of flights, how do you walk up and down those stairs to use that as your step machine in this moment, right? How do you, at the same time, for example, practice something called chair yoga? And looking up videos online, either on YouTube, exercise videos, can be hugely helpful to keep people organized around their exercise or their physical activity. So Googling or YouTubing chair yoga and looking at a 15-30 minute exercise routine where people don't have to get up and have to walk around, and because especially if they're limited with arthritis or chronic pain in any way. So that's, my patients have found chair yoga, walking up and down, when they're more able, walking up and down stairs in their own home, using any heavier object in the home, like for example, a heavy book, and taking two heavy books and lifting and alternating, picking up those heavy books can be really great for strength training, for example. So you don't need to have special dumbbells or special equipment. Just getting 2 gallons of milk, for example, and lifting, a gallon of your gallon of orange juice and your gallon of milk, and it has a nice, already it's got a built-in handle that's really, it's easy for picking up. And so, alternating, lifting that back and forth, so you're getting a little strength training in. I think one of my go-to exercises that I've seen that patients really, really enjoy, especially in this moment, that combines both of what you just mentioned, Colleen, around stress and also physical activity, is yoga. Yoga has been shown to be extremely helpful for stress management, and also with all the sitting that we're doing now more than ever before, with all of the either on Netflix, watching Netflix, or on Zoom calls for hours, or sitting on our phone watching what the latest news story is, right? Like 6 hours later we're still watching that news story. There's so much back pain. Oh, there's so much low back pain right now from all that sitting. So I recommend for my patients also that to really almost program in their phone a little alarm that goes off almost every hour that reminds you it's time to get up. It's time to get up, change your position, do a little stretching, get on the floor and really hug your knees, bring your knees up to your chest and just roll back and forth. That's a little way to give yourself a massage, as well as keep those muscles stretched out, because if the muscles aren't stretched out, then it's really going to be harder to exercise in general or have physical activity in general. So those are some of my tips, but dancing in your house, turning on some music, and for 30 minutes, your favorite song that you love to move to, and that's exercise. That's exercise. Gardening is exercise. If you happen to have the opportunity to get outside and garden a little bit, or sweep the front or sweep the back of your house, that's exercise too. That's physical activity as well. So, and the way to think about, am I getting enough exercise? The American Academy of Family Physicians says 30 minutes, 5 times a week, so about 150 minutes a week. Doesn't have to be 30 minutes at a time. 10 minutes spread out over 3 times in the day is as beneficial as doing all 30 minutes at one time. The important thing about physical activity and health is that it's good to do it every 48 hours, not take a long break, in other words. Once you're doing it every 3 days or every 4 days, you've lost the benefit of the exercise, especially when it comes to diabetes. So you want to do it about every 2 days, to do it 2 days and maybe take a break and then 2 days. Entonces, Colleen me acaba de preguntar de, por ejemplo, ¿qué podemos hacer ahorita para ejercicio durante este momento? Porque estamos adentro y es difícil salir porque vemos las personas que no tienen las máscaras o quizás no queramos salir porque es muy difícil salir. Tenemos dolor de cuerpo, estamos más vulnerables, no podemos contagiarnos o estar afuera en el público. Y lo que le estaba explicando es que muchas veces en la misma casa podemos ser muy creativos. Por ejemplo, si tiene unos escaleras o escalones, puede caminar para arriba, para abajo esos escalones, por ejemplo, porque eso es fantástico ejercicio. La otra cosa que puede hacer, por ejemplo, es la yoga en una silla. Hay muchas maneras de buscar videos por el YouTube que le puede dar como unos 15 minutos, 30 minutos de yoga en una silla, para especialmente personas que están más ancianos o también tengan dificultades artríticos. Las otras cosas que uno pueda pensar es, por ejemplo, hay muchas cosas en la casa que puedan pesar un poquito. Por ejemplo, dos libros pesados. Si usa dos libros pesados para levantarlos, eso va a darle mucha ejercicio para la fuerza de los músculos. O, por ejemplo, recoger un galón de leche y un galón de jugo. Ya esos galones, levantarlos de esa manera, eso le va a dar ejercicios sin tener que comprar aparatos especiales, ¿verdad? Lo que le quería decir es que, ahorita estamos sentados muchísimo. Estamos sentados todo un día mirando el Netflix o en nuestras conjuntas por Zoom, o estamos mirando nuestro teléfono todo el día, 6 horas de mirando la noticia, ¿verdad? Sentados. Y eso nos está dando mucho dolor de espalda. Mucho dolor de espalda que en realidad lo que estoy tratando de avisarle a mis pacientes es que prácticamente necesita uno programar en el teléfono que cada hora le timbre el teléfono para recordarle, es hora de pararse, es hora de cambiar la posición, quizás acostarse un poquito y levantar las rodillas al pecho y darse unas vueltitas para darse un masaje a la espalda, ¿verdad? Porque si esos músculos están apretados, va a ser tan difícil hacer ejercicio. En realidad se necesita uno más estirarse para poder tener los músculos más preparados. En total, el ejercicio tiene que uno ser muy creativo, pero esas son las ideas que le he dado a muchos de mis pacientes. Y la yoga, le iba a decir, es uno de mis favoritos porque la yoga combina lo que acaba de decir Colleen. Colleen estaba hablando de la ansiedad, ¿verdad? La yoga ayuda con la ansiedad y a la misma vez ayuda a los músculos que estén preparados, relajados para prevenir el dolor y dar más fuerza también. Combinado, una manera de hacer ejercicio también y manejar la ansiedad, la yoga. Y puede uno buscarlo por el YouTube. Hay muchos programas gratis por el YouTube para esos ejercicios.
Okay, thank you.
Of course.
And so this next question actually is not only on our list, but then was posed by our executive director on Facebook a few minutes ago. So voice buildings are home to multiple families and individuals. Often, even though we do have some individuals and smaller families, we have large families in some of our units as well. And there's just concerns about what's the best way to protect yourself, your families and neighbors, aside from just that, but if, for example, someone in your family is sick and there isn't a room to necessarily isolate them in, what's the best way to go about handling that situation? And again, in the common areas in the buildings, how can we be respectful of other people who have to use that space? And yeah, just
great question.
What are your thoughts and suggestions?
Great question. So many of the families that I take care of at Heartland Health Centers are living in the situation that you've just described, Colleen, where it's actually large families and multiple families living in the same apartment. And it's been very challenging to protect all of the other members of the household when one member becomes sick. Absolutely. When there is an additional room the recommendation is for that person who is ill, that's fallen ill, is to isolate themselves from the rest of the family, to go into that room and isolate themselves for at least the 14-day quarantine that we're recommending. And when they come out, they're wearing a mask. And when they are certainly using those common areas of the apartment, especially common areas that everyone else, right, is going to come in contact with, that those areas be cleaned repeatedly and thoroughly throughout the day. That person who is sick, they have COVID, on their hands. They go to touch a doorknob, or they go to touch a counter on the kitchen counter. They go to prepare a meal for themselves. All of those spaces are spaces that the other family members have to use. So cleaning those down as much as possible is critical. And we're recommending bleach products, right? Because bleach products kills the virus. So making sure you're using bleach products for all of those services. They're wearing a mask. The other members of the family of that household are also wearing masks within that household. And certainly this is not the time to invite people over to the house. This is not the time to have friends over or to have relatives to come visit. It's very challenging in our communities when someone is sick. The practice is for people to visit, for people to come over and bring food and bring gifts or bring support. And that's all really still encouraging. But this is the moment to come by and maybe from the window, say hello. This is the moment to send them an email. This is the moment to FaceTime them, to WhatsApp them, to reach out to them in a way that's as safe as possible for themselves, and certainly for that person in front of them as well, for the person they're contacting. So leaving the food at the front step, for example, or the flowers that you're delivering. This is not the moment to come in to the house. And if there isn't that extra room, and many times there is not that extra room where people can isolate themselves, preparing an area of the apartment that is their special designated area is what I recommend for families. This is an area that, of all the areas of the house, we can at least be assured that this is the area that is special for them, right? And that's the area we shouldn't be interacting a lot with, right? We shouldn't be laying on their bed. We shouldn't be sitting in their chair, or touching some of the items that they use all the time, or using their sheets, or using their towels. So that would be my strongest recommendation in that scenario, in that situation. Okay. Yeah. And in Spanish, so la pregunta de Colleen es cómo se hace, por ejemplo, si un paciente está enfermo, una persona está enferma y está viviendo con varias personas o familias. Y lo que le estaba diciendo a ella es que sí, yo tengo esa experiencia porque tengo muchos pacientes que están viviendo no solamente la familia en la familia de ellos, pero con otras familias. Y están viviendo en espacios muy pequeños, quizás con un cuarto. ¿Cómo se pueden proteger los otros miembros de esa familia o la otra familia cuando alguien está enfermo? La primera cosa, la recomendación que les puedo dar es que, por ejemplo, si hay un cuarto que se le pueda apartar a esa persona, ahí es donde debe estar viviendo esa persona en cuarentena por siquiera esas 14 días hasta que ya no tengan síntomas. Esos 14 días estar en ese cuarto, y cuando ellos salgan del cuarto, usar una máscara, tener una máscara puesto, y todas las cosas que vayan a tocar, por ejemplo, que son muy común que las otras miembros de la familia también toca, todos esos lugares, la puerta, la cocina, donde uno vaya a preparar las comidas, todo eso se debe de limpiar con un producto de cloro, ¿verdad? Porque el cloro va a matar el virus. Y con mucha frecuencia, con mucha frecuencia. Así es como vamos a evitar que los otros miembros vayan a tocar esas cosas, tengan el virus en las manos y se vayan a tocar la cara o la nariz, la boca, y se vayan a contagiar. Y también tan importante ahorita es, este no es el momento, por ejemplo, de invitar a las personas a la casa. Tenemos unas costumbres que cuando se enferma alguien, Es el momento de venir a visitar a esa persona enferma, a traerles cosas, a traerles comida, a traerles regalos, a darle el apoyo. Pero en este momento la manera de protegerse a usted y a proteger a todos sus miembros de la comunidad es hablar y dar ese apoyo a la persona a la distancia. Quizás venir a la puerta y de la ventana decirles un saludo, darles un saludo, o llamarlos por FaceTime, o llamarlos por WhatsApp, o mandarle un correo electrónico, ¿ya? Y si van a dejar cosas a la casa, dejárselos ahí enfrente de la puerta, no entrar a la casa. So, dejarle la comida o las flores o las cosas que quieran ahí a la puerta, no entrar a la casa, por favor, porque si entran, tienen el riesgo que vayan a captar COVID y van a salir con COVID a la comunidad, okay, o a sus familias. So en total, esas son las cosas. Si no tienen un cuarto especial para esa persona, lo que recomiendo, por ejemplo, es asignar una sección de la casa o del apartamento que es para esa persona, ¿ya? Siquiera sabemos que esa es la sección de esa persona, o no vamos a estar, por ejemplo, sentados ahí, usando las mantas, usando las toallas, o sentados en la silla de esa persona, porque esa es esa designación de la persona, ¿verdad? Entonces vamos a tener más cuidado en esa área de no entrar o usar esas cosas en esa área. Okay. So eso serían mis recomendaciones para personas que están viviendo juntos.
Thank you.
Of course, of course.
So Lori, we have like one more question that we've prepared, but I think I'm going to save that one till the end regarding like testing and information about that. But Lori, did you have a question that I know you mentioned you prepared a few that you would like to ask Dr. Sonia at this point in time?
Yes, I do. Thank you. I wanted to know, Dr. Sonia, where do you see when it comes down to our future children? Like, for instance, when they're going on field trips, because it's hard for the adults. We know that first, washing hands and this and that and the other. We know some people, like the homeless people, I know they are high risk at all times that they're out there. Yeah. And they can't get to a bathroom to proper take care of themselves. Yeah. But when you come down to children, like in the future, do you see like field trips and stuff? Is that going to be probably something you don't see ever happening again with our children due to COVID? Also riding the school buses, because even if they wash their hands or using hand sanitizer, I'm not sure what's more effective for them for as hand soap or when they out and about. So the sanitizer should be used only when they're on the buses or getting off the bus. So do you see that in the future, or that might be something that they might completely take away with no field trip, and which can be really bad because it can be a learning experience for them to go out and know what's going on.
Great question. Yeah, no, great question, Lori. I would say that during this time, all that activity is such a special activity. It's such a milestone activity in a child's life, right? Going on their first field trip, you know. I still remember the first time I went to the zoo with my class. It was so special. It was the first time I kind of got out of my neighborhood too. You know, I didn't even know that there was a zoo in Chicago until I went on a field trip. So we don't want to deprive our children of those kinds of experiences, right? Because they're such milestone experiences. But what I predict and what I imagine will happen with time is an adaptation of all of those experiences, Lori. Like, for example, it may take then, we can't have all the kids on one school bus. It'll have to be 2 school buses, for example. So there can be social distancing that can happen on that bus. Your question about, for example, is it better, how are they going to keep their hands clean? You know, kids, how are they going to keep their hands clean during these activities? And is it better to wash your hands with soap and water, or just have that hand sanitizer with you? Hand sanitizer is a second option. The first option is always, the best option is always good old-fashioned soap and water. Now, it's tricky because, you know, how often do kids like wash their hands for that 20 seconds recommendation, you know? I mean, most adults don't wash their hands for that long. They wash their hands like 5 seconds later, they're done. So it might be some supervision, so the teacher or parents overseeing the hand washing, so kids are doing it properly. And if it's not possible to access soap and water, then yeah, absolutely having hand sanitizer is going to be a very important second option. So as kids go out and they get off that bus and they explore and they're touching railings, they're doing, leaning over, looking at the zebra, they can, probably by the time they're getting back on the bus, they're probably doing a little hand sanitizing before they get on the bus again. So a little before they leave, when they get off the bus and when they come back on the bus. And I think for social distancing, I'm imagining that there will have to be more than one bus, Yeah. Yeah, and that all, again, these are all ideas. I know that I can't imagine that as creative as we can be about a restaurant, for example, or creative as we can be about a barbershop or a salon, my goodness, we can be as creative about our children's experiences and their education. We have to be. Great, great question. And lo que me acaba de preguntar Lori es de, por ejemplo, cómo envisiono el cambio de recreaciones para los niños, por ejemplo, la primera vez que van a una excursión, de la escuela, juntos como una clase, y le estaba diciendo, son actividades tan especiales, ¿verdad? Son las actividades que nos forman como seres humanos. Me recuerdo yo la primera vez que fui al zoológico y fue algo increíble, la primera vez que salí de mi barrio y reconocí que había un zoológico en Chicago tan excitante, tan increíble. No le podemos quitar esas experiencias a los niños. Entonces, lo que me imagino que vaya a ocurrir es que vamos a tener que usar más de un autobús. No puede ser un bus que todos los niños están en ese bus, pero vamos a tener que usar varios para poder practicar distancia social. La otra pregunta fue de lavarse las manos, de cómo vamos a tener estos niños con las manos limpias. Los niños tocan todo, hacen de todo, van a salir y tocar a todo lo que vean. Y entonces lo que le quería decir es que la manera de limpiarse las manos más eficaz es jabón y agua. Jabón y agua y lavarse las manos por unos 20 segundos, ¿verdad? Pero es tan difícil que los niños se laven las manos por 20 segundos, ¿verdad? Es súper difícil para los adultos hacer eso. Los adultos se lavan las manos en 5 segundos y ya se terminó todo. Entonces, me imagino que vamos a tener que tener mucha supervisión, que por ejemplo las maestras o los padres que vienen en esa excursión van a estar ahí vigilando cómo se lavan las manos bien. Y si no hay manera de accesar la agua y el jabón, entonces sí, los productos para mantener las manos limpias, los productos de hand sanitizer, perdónenme que no lo sé en español ahorita, se me está escapando la palabra, pero esos tipos de productos definitivamente van a tener que ayudar y van a ser importantes de usar en este momento. Y me imagino que van a tener que usarlos cuando salgan del bus y cuando entren otra vez al bus. Entonces, pero son tan importantes esas actividades. Si tenemos la creatividad de cambiar nuestros restaurantes, nuestros bares, a donde nos cortan el pelo, ¿cómo no vamos a tener la creatividad de cambiar las experiencias de nuestros niños, ¿verdad? La educación, la experiencia educativa de nuestros niños. Sí lo tenemos que hacer.
Thank you.
Yeah.
All right, Lisa, were there any questions from Facebook, our audience on Facebook, that we might want to go over at this point in time?
There were, and so I'm taking a look at our Facebook Live questions right now. There are a few questions that I feel like Dr. Oyola has addressed already, but I will ask them, a few of them that I feel that are most relevant. This is from Ms. Tamara, if a person has had COVID and has recovered, is it still possible to infect others?
Oh, great question. What a great question. That is still, first of all, once you've had COVID and you've recovered from COVID, you're no longer contagious. You're no longer able to pass COVID on to your neighbor, your friend, your family member. But the question is, how long after you've caught COVID and you've recovered from COVID, are you still protected from catching COVID again? And that we are not clear on, because immunity, being immune to something, how long we are immune to a particular, after we've been infected, varies depending on the type of infection. And for example, the common cold, we can all relate here how often we can catch the common cold in a winter season, right? 2 times, 3 times, we can catch the cold pretty commonly. And that's because our immune system doesn't produce antibodies, and these are technical words to just say our immune system doesn't keep us protected for the rest of our lives. So even though we're recovered, so first of all, to your question, once you're recovered, you're no longer contagious, but that doesn't mean you cannot catch it again. And that's the tricky part. That's the challenging part. That's the part that's still being investigated and we're going to have to, we're hopeful that we will have clarity about that answer, because, the people that were first impacted by COVID, the people living in China that were first impacted by COVID, we have a lot of data coming from those countries about, there's my dog again.
All right. Earlier, my cat decided he wanted to talk.
I know.
So.
So that's what we're still debating. How long are you still protected? This is a pet-friendly show, everybody. Dogs and cats and all kinds of things. Yeah, so how long are you still protected? That's what we're not sure. So for example, it would not be wise to think, now that I'm recovered, I can go out without wearing a mask. I don't have to practice social distancing. I can go to the grocery store. I'm safe now. I'm a safe person now. I can't give it to anyone and I can't catch it. No, it's true. You cannot give it to someone while you're not infected, but you can get reinfected. Yeah. So, entonces, en español, lo que quería explicar es, la pregunta es, ¿por cuánto tiempo, si ya sea uno recuperado del COVID-19, es posible pegarle esta enfermedad a otra persona, ya que se ha recuperado? Y la respuesta de eso es que ya cuando usted se ha recuperado, ya usted no es contagioso. Usted no puede pasar esta enfermedad a otra persona. Pero no se sabe por cuánto tiempo usted tiene el sistema inmunológico, la protección. No se sabe por cuánto tiempo se va a demorar esa protección, que usted no pueda captar el virus otra vez. En este momento no sabemos eso. So, hay la idea que uno pueda posiblemente captar ese virus otra vez. Especialmente, por ejemplo, todos aquí podemos reconocer que en el invierno podemos tener muchos catarros. 1 catarro, 3 catarros por todo ese invierno. ¿Por qué ocurre eso? Ocurre porque el sistema inmunológico solamente nos protege por un cierto tiempo. También es porque son diferentes viruses, ¿ya? So, en esta circunstancia, yo le diría, si ha recuperado del COVID, no es el momento de decir, oh, yo estoy sana, yo estoy bien, yo puedo salir sin mi máscara, no tengo que practicar distancia social, ya no me tengo que preocupar porque yo estoy sana y no le puedo dar algo a nadie y no lo puedo captar otra vez. Es verdad, no se lo puede pegar a otra persona ya que se ha recuperado, pero es posible que la pueda captar otra vez. So, tiene que, por favor, todavía usar su máscara, lavarse las manos, la distancia social, todo eso sigue. Todo eso sigue hasta que tengamos más información y sí vamos a tener más información porque hay países, por ejemplo, la población, la gente que estaban viviendo en la China, esas personas fueron impactadas súper temprano, ¿verdad? Y entonces esas personas podemos mirar cómo se han recuperado y qué les ha pasado a ellos después de esa recuperación. So, sí vamos a tener más información, pero por ahora todavía no tenemos claridad si se le pueda pegar otra vez. Okay, sígase protegiendo.
Thank you.
Of course, thank you.
We have 2 more Facebook Live questions. The first being, you've seen a doctor and for COVID symptoms, and the doctor says you have something else. The person's wondering if there's any way that that diagnosis was incorrect, or whether these diseases can mimic one another in symptoms.
Great question. What a great question. That's probably why at this time in our history, in the history that I know as a doc, I have never known a more important time to have a primary care doctor. Because a primary care doctor can really fully, because they have a relationship with you, right? You've been educating each other for so many years, right? That patient's been educating me like I've been educating patients. This is the time that we can fully explain why we think something may be COVID or not. And it's absolutely true that a lot of these respiratory conditions can look very similar. For example, asthma. If you have an asthma exacerbation, you can have cough, you can feel short of breath. If you have allergies and you have postnasal drip can make you cough and have a sore throat. Those are the symptoms, the common symptoms of COVID that we talked about earlier in the talk. So, but sitting down with a primary care doctor who really knows you and knows your history and knows, you know what, Mrs. Jones, they've never had postnasal drip before. You know, I have a long history with them. They've never had allergies. They don't have a history of asthma in the family, and they're coming in with cough and shortness of breath. I think it's very likely that it's COVID. While the same patient who has a history, allergies, asthma, other things, reflux, sometimes just heartburn can make you cough and make you short of breath. You know, that person has those kinds of medical histories, then we can say, okay, you know, COVID is still on the list, but maybe it's more likely that this is their asthma exacerbation. For example, they don't have fever. They haven't lost their sense of smell or taste. The cough only happens when they're around dust, right? So, you know, all of that information helps us figure out what's probable and what's less probable. And that's how we decide what we should test or not. The last thing you want to do is test when it's not probable, because if the test comes back falsely positive, then we're telling people you have it when they really didn't. So we order a test depending on what's the probable thing here. If it's probable, if this is likely, let's test it, because it'll confirm what we're thinking, okay? Now, right now, I tell you, because COVID is the number one upper respiratory issue that's happened, that is occurred since January in the U.S. We absolutely, it would take a lot of information for me to think this is not COVID. But again, gathering that information is what really helps make those decisions. Okay. The other thing is with that primary care doctor, you follow up. You know, it's about probability. So you say, you know, I'm thinking it's this, but if things were to change, let's check in with each other in some number of days. You know, let's check in a week, in a few days. Because if things were to change, then suddenly those other ideas we were thinking of, that's more probable. And let's change our plan. So that's how we go about it. And it's a great question, such a great question. I hope that answered it. In Spanish, you know, en español, la pregunta es, por ejemplo, la pregunta por Facebook es, fue al doctor y tuvo síntomas que se parecían mucho a COVID, pero el doctor no pensó que era COVID. Y entonces la pregunta es si es un error esa diagnosis. Y si, por ejemplo, hay otras enfermedades que se puedan mirar muy similares al COVID. Y lo que le estaba explicando a Lisa, le estaba explicando a la persona que dio la pregunta, es que sí hay muchas enfermedades que pueden verse muy similares al COVID. Entonces, en ningún momento en mi historia como doctora, he visto más la importancia de tener un doctor primario. Porque el doctor primario es un doctor que, por ejemplo, el paciente ha educado y ese doctor ha educado al paciente por tantos años. Se conocen mucho, se entienden. Y ese doctor le puede explicar las razones en por qué piensa o no piensa que sea una enfermedad. Por ejemplo, la pregunta de si hay otras enfermedades que se puedan mirar como el COVID, absolutamente sí. Por ejemplo, el asma. El asma le da tos, le da falta de la respiración. Las alergias pueden dar desecho postnasal, que pueden irritar la garganta, dar dolor de garganta y tos. Y esos son los síntomas más comunes del COVID. Pero con esa conversación que usted tiene con el doctor primario, pueda, por ejemplo, dar más datos que nos diga, esto es más probable o no. Por ejemplo, si la tos solamente ocurre cuando está cerca de un polvo, quizás sea al asma. ¿Ya? O si en la historia médica el paciente tenga una historia de alergias, quizás son más alergias, ¿verdad? Todas esas informaciones nos ayudan a decidir qué es probable y qué no es probable. El COVID todavía está en esa lista, pero es decidir cuál es la probabilidad, porque no queremos hacer una prueba sin probabilidad. Si se hace una prueba, cuando uno piensa que esto no es probable, ¿qué si la prueba sale positiva? Y es falso. Hay muchas pruebas que salen falsas en positivas, pero son falsas. Entonces ahora le estamos dando un diagnóstico al paciente que no es real, no fue real. Entonces es tan importante decidir hacer una prueba basado a las probabilidades. La otra razón en por qué es tan importante tener un doctor primario es porque con ese doctor se va a ver otra vez. Se pueden decidir, vamos a hablar otra vez en una semana, un par de días, a ver si algo cambia, a ver si, por ejemplo, si algo ha cambiado, tenemos que cambiar nuestras ideas. Las otras ideas que estábamos pensando, quizás son esas ideas y quizás vamos a tener que cambiar el plan y hacer esas pruebas. Entonces, es una pregunta tan importante, tan especial y en esta situación mucha educación se necesita para saber las razones.
Great. And our final question that we're going to have time for from the Facebook Live questions. I know there's some other questions in the queue, but in the interest of time, this will be our last one.
Okay.
Is it okay to visit with family and friends who are 6 feet away, all still wear masks when visiting with family and friends when we are outside and distanced?
Okay, such a great question. This is the question of the hour because it's getting nice out.
Yeah.
We see those parks. Oh my goodness, they just looks beautiful out there, and everyone wants to get together and see each other after not seeing each other for so long. If you have the capacity to maintain social distancing, you wear your mask, you're washing your hands very often before you get to the setting, the gathering, and after the gathering. If you're able to do that, the recent recommendation is that people 10 or more, 10 or less, my apologies, 10 or less can gather safely, okay? That's the most recent update. Beyond 10, then it gets trickier to do that social distancing. It really does, you know. It's tough to find that space that will allow 6 feet between each other for 20 people. By the time that happens, I don't even know if you know who's there. So if you're able to wear masks, social distance, and lots of hand washing, that you absolutely can see family and friends in that manner. Okay. And I think that was the whole question.
Yes.
Ok. En español la pregunta fue si está bien ahorita, es sano conocerse, encontrarse otra vez, reunirse otra vez con nuestras familiares, nuestros amigos. Y es la pregunta de la hora, ¿verdad? Porque estamos ahorita en un clima tan sabroso, vemos los parques, todo está tan bonito, queremos reunirnos con las personas que no nos hemos visto por tanto tiempo. Se entiende ese deseo. Y lo que le estaba explicando a Lisa es que Si se puede usar su máscara, mantener su distancia social de 6 pies o más, lavarse las manos mucho antes de llegar, después de irse de la reunión. Ahorita se está viendo que 10 personas o menos está bien hacer eso. Pero ya pasado de 10 personas, más de 10 personas, es muy difícil mantener una distancia social. Súper difícil porque no tenemos el espacio para mantener esa distancia social con más de 10 personas, ¿verdad? Entonces, si se puede mantener esas prácticas, 10 o menos personas, sí, está bien verse otra vez con sus familiares. What I wanted to add though in English is remember though that as you're reuniting with your family members, that there are still people at much higher risk of catching, when they catch this, of having very severe case of COVID, and that's anyone over the age of 60, right? So, although you're so tempted to reunite with your grandma and have like all the kids come and see her and be around her, that might be the person that I would say as a gathering of less than 6. I think would still be, that was a more stricter recommendation as we started this sheltering in place. And I would go back to kind of that stricter recommendation if you're going to have a family member there or a friend there that's older than 60 or is has an immune suppression issue. Just be really much more careful with that individual than the other members of your family or friends that you're meeting up with. Entonces, en español les quería decir que lo que quería incluir es que hay todavía ciertos miembros de la familia o familiares, amigos que son más vulnerables, y esas personas que son pasados de 60 años, ¿verdad? O tengan un sistema inmunológico que está más frágil. A esas personas yo diría 6 personas o menos para las reuniones, y usando mucho la máscara, la distancia social, lavarse mucho las manos. Hay la tentación de mirar a la abuela otra vez y traer todos los niños a ver a abuela, pero todavía esa persona, tenemos que tener extra cuidado con esa persona porque cuando ellos captan COVID, la situación es mucho más severa, como ya conocemos.
Okay, thank you. And thank you everyone who has written in to ask our Dr. Sonia questions. To wrap things up, I know we're a little past the initial time. We did get started a little late, but so we just wanted to cover and go over like testing and testing recommendations, who should get tested, where, kind of how that looks, especially at Heartland Health Centers, because you work here at the one in Uptown on Wilson, correct?
I work at the one on Tui.
Oh, the one on Tui. Okay, well, there is one on Wilson, so.
There is, actually. There is.
So anyway, if you can just share a little information about testing and recommendations there, that'd be helpful. Thank you.
Absolutely. So, thank you for that question, Colleen. And I would say that, what's really exciting is that the state of Illinois has recently opened up a lot of free testing sites, right? There aren't a lot here in Chicago. There are 2 here in Chicago, but across the state, finally, without symptoms, without, any particular requirements or specific points that you have to check off, and without insurance, you can get tested for free through the state of Illinois as these free testing sites. I consider, that an incredible resource. Is still a limited resource because there are only a couple here in Chicago, but particularly for people that do not have insurance, really seeking out those sites that's very important. But we do at Heartland also have free testing, and everything related to the visit around COVID, the testing for COVID, and the after follow-up care for COVID is included and is free for our patients without insurance at Heartland Health Centers. The first step would be to call our center, call us at the 773-751-7800 number, and to make a telemedicine appointment. And the visit would be with a healthcare provider, and that healthcare provider can go through that conversation that I described earlier, about figuring out what's the probable diagnosis here, And if it really does look like this is COVID, or you've recently been really exposed. Let's say, for example, you've been out at one of the rallies, the recent protests, and you've had a lot of contact with a big crowd of people, or you're a healthcare provider, or you're working in a nursing home, or you're a caregiver for someone who's older in your home. There are a lot of reasons, honestly, to get tested without having symptoms, okay? But that first visit with us will help us figure out, whether you're at high risk of having been exposed to it, or whether your symptoms are because of COVID. And if we do believe that you need to get tested, and we're recommending the testing, the next step is for you to have a telephone visit with our nurse, and our nurse will schedule a COVID testing appointment. And that's really important because to set up that appointment, because we don't want a lot of people coming at one time to get tested, because that's contraindicated, right? That'll be contrary to our mission. We're trying to protect each other. And so with that appointment, we can space out the visit, and it's a drive-up testing. So you actually don't even get out of your car. You drive up, and the nurse will teach you that you should wear a mask when you come up to the center, what time, of course, to come up to the center, how to stay in the car, and who will approach the car to actually do the collection, the nasal collection. And then once you get tested, then obviously the results come back to the provider who ordered the test, and then we would call you with those results and go on from there, okay?
I did have a quick question, sorry to interject. If you don't have a car, well, and no one's willing to give you a ride because you're sick, what does that look like?
That's a great question. And my apologies that I don't know this right off the bat. I know for our first protocols were just with driving up. We may have changed that to walking up now, but I'm not 100% sure. So I'll get that answer for you.
Okay, thank you.
Of
Sorry to
course.
put you on the spot there.
No worries at all. That's something that I don't really know. I don't know. So I'll get that answer for you. But so once once you get tested, then we follow up with the result and we move forward, in it. And we have through Heartland Health Centers, we have 3 locations that are doing free testing for our patients. So we encourage people to call us up, make that initial appointment, that telehealth appointment, so we can set the patient up for any need for testing. Okay. We also have some health fairs or some testing fairs that we've also started in the community, so people can get testing that way as well. And we do have the ability for walk-ins to those fairs as well. So that doesn't require driving up, but so at Heartland we are offering a lot more expanded testing than we have historically. Yeah. So en español la pregunta es la prueba, quién se puede hacer la prueba, quién se debe de hacerla o no, y a dónde se puede hacerla, especialmente en Heartland Health Centers, a donde trabajo. Y lo que le diría es que primeramente ahorita la noticia buena es que el Estado ahora se ha establecido varios centros por todo el estado a donde se puede hacer la prueba gratis y no necesita uno tener síntomas tampoco. Tampoco no tiene que tener seguro, tampoco no tiene que tener cualquier requisito, los requisitos que antes teníamos porque no teníamos muchas pruebas. Aquí en Chicago hay 2 por el estado de Illinois que son gratis al público, que serían recursos importantes de accesar para las personas que no tengan seguro, pero también para las personas que no tienen seguro se puede hacer la prueba en Heartland Health Centers. Y la manera de hacer la prueba con nuestro centro es primero llamarnos a la 1773-751-7800. Y cuando uno llama ese número, le vamos a programar una cita con una proveedora de salud, y esa cita va a ser por teléfono, es telemedicina. Y entonces en esa cita vamos a tener una conversación, ¿verdad? Para saber cuál es la probabilidad, si es COVID, si no es COVID, o de si la persona tiene síntomas. Si la persona no tiene síntomas y está llamando para una prueba, podemos hablar de cuáles son los riesgos que han sido expuestos al COVID. Por ejemplo, las personas que han salido ahorita con las protestas, que han estado en grupos muy grandes, esas personas tienen mucho más riesgo a ser expuestos al COVID. So, podemos determinar riesgo o podemos determinar si si la diagnosis es probable basado a los síntomas. Y si decidimos con el paciente, si recomendamos que se haga la prueba del COVID-19, le hacemos una cita con la enfermera. Y la enfermera le va a explicar cómo venir, le va a hacer una cita para la prueba. Y entonces esa cita es programada de esa manera para evitar que muchas personas vengan a la misma vez a hacerse una prueba. Eso es contraindicado en este momento, ¿verdad? No queremos que bastantes personas estén juntos. Con esa prueba programada, podemos indicarle que por favor usen una máscara, vengan manejando, vengan en su carro, quédense en su carro porque va a venir la persona al carro para hacerle la prueba, para tomarle la muestra, ¿ya? Y vamos a explicar todas las personas que se le va a acercar al carro. Una de las preguntas que me hizo Colleen es que, por ejemplo, ¿cuáles las personas que no tienen carro? ¿Cómo se hace con esas personas? Y en realidad no sé esa respuesta, pero yo les voy a dar le voy a investigar eso y le voy a decir a Colleen para que todo el mundo en los apartamentos, para que todo el mundo aquí sepa si también estamos aceptando pacientes que caminen, que vengan caminando sin carro. Pero sí tenemos también unas ferias. Hay 3 lugares en el que estamos haciendo las pruebas, pero también estamos haciendo ferias en la comunidad a donde se hacen las pruebas, que las personas sí pueden venir caminando ahí a la feria para hacerse la prueba también. Sí estamos expandiendo todas las maneras que se pueda hacer esta prueba en la comunidad.
Great. Well, thank you. Lori, did you have any final remarks or anything you'd like to say as we close out?
Yes, I do. Just one final remark. I think, I guess it's more so of a comment, and I guess it's a little bit about my dog because I know that he been kind of like, I keep him distance from other dogs, but he's kind of like depressed and he wants to get close to some of the dogs. So one of the things I think I was doing with him is just to keep him distance and like let him play in the area by himself. And we see another dog, we just cross the street. But so far so good. The CDC haven't said anything about dogs actually like and how they catch it or whatnot. So I was a little concerned about that. But I guess I'm going to practice safety by keeping him distant until we get further information on that. Then I'm kind of keeping him distant. Is that the best way to go, doctor?
I think that is the best way. And honestly, Lori, I think it's also, it's tricky to have the dogs play with each other and not have those 2 humans come closer to each other too. Like if the dogs somehow get into a little tussle, right? And we have to come and untangle their leashes or, get them off each other. We're suddenly going to be like this close to the other dog owner. So I think for that reason alone, I think what you're doing makes a lot of sense. Letting your sweet dog play where they can play freely in a little area safely. And if you see another dog coming, then crossing the street. So there isn't that risk of everybody suddenly having to come together. Yeah.
Thank you so much.
Of course. Yeah, and you're right. I haven't seen anything about the CDC saying that, this is something that dogs can catch or cats can catch. But that's still, again, being thought about and looked at. And so it's good that you're being so mindful about that. It's really great. La pregunta de Lori es, por ejemplo, su perito, que ella ha notado que su perro en veces se está sintiendo un poquito solo, ¿verdad? Porque está tan acostumbrado a jugar con sus amigos, sus otros peritos, que entonces ella se siente un poquito triste que no pueda hacer eso. Pero lo que ella está haciendo ahorita para tener protección, para proteger a su perro, es dejar al perrito jugar a donde esté sano jugar solito, pero cuando ya ve a otra persona con su perro venir, trata de cruzar la calle para que los perros no tengan contacto. Y lo que le estaba diciendo es que su pregunta es si esa es la manera de seguir, lo que recomendaría yo también. Y yo le recomendaría eso, más porque, ¿sabe? Cuando los perros se juntan, se van a juntar los dueños del perro, ¿verdad? Porque los perros están jugando y en veces se enredan y se empiezan a morder o empiezan a hacer cosas y entonces se tienen que juntar los dueños para separar a los perros o mejor para prevenir ese momento que todo el mundo se tenga que juntar. Sí, le recomiendo hacer lo que ella está haciendo, que cruza la calle y por este momento para no tener bajar el riesgo de esos momentos, ¿verdad? Ya, pero qué bueno que es una pregunta muy buena y muy especial.
Thank you.
All right. Well, thank you again, everyone for joining us, everyone on Facebook watching, for everyone's questions, and of course, Dr. Sonia, for your time today, sharing your expertise. We did have one of our residents on Facebook say how she really likes this doctor, so you're already getting positive feedback. And I hope that, you know, everyone continues to stay safe and healthy, and gets the opportunity to enjoy some of this nice weather in a safe way. So.
Thank you. Thank you, doctor, again.
Oh, my pleasure. Such a pleasure to meet you, Lori. Thank you so much. And a pleasure to be with you, Lisa, as well. And thank you again, Colleen. What a pleasure. What
of course. Thank you. All right. Bye, everyone.
Take care.
Be well. Take care.
Bye-bye.